I recently had a client that was diagnosed with something called an insufficient cervix. And she was like, what? What does that even mean? And her doctor then recommended a cervical cerclage. And she was like, double what? What? Like, he's speaking a foreign language. I don't understand anything he's saying. And so I figured other women might be confused by the phenomenon of an insufficient cervix and a cervical cerclage. So, okay, an insufficient cervix, sometimes it's also called an incompetent cervix. Neither name is great. This essentially is when the cervical tissue is weak and it causes or contributes to premature birth, or in some cases, a pregnancy loss. And so before pregnancy, the cervix, which is the lower part of the uterus that opens to the vagina, it's supposed to be closed and firm. And then as the pregnancy continues, the cervix very, very softly softens, it effaces, which means that it decreases in length, and then eventually it starts to open or dilate. And if you have an incompetent cervix, all of this starts to happen too soon. It starts to open too soon, which again can lead to that premature birth. And unfortunately, it can be pretty difficult to know if a woman has an insufficient cervix. But there are some symptoms that you can look out for. Typically there aren't many symptoms in early pregnancy, but starting around like between week 14 and 20 of gestation, some women start to have a little bit of spotting, some pelvic pressure, like a new backache that wasn't there before, mild abdominal cramps, a change in vaginal discharge. And so again, it's always wise to let your care provider know if you have any kind of new uncomfortable symptoms, or even if you're just concerned about, even if you have no symptoms, but you just want like an ultrasound or some blood work, vaginal exam, just let them know. Okay, so risk factors. So a lot of women that experience an insufficient cervix don't have any risk factors for it. It just kind of happens. But there are some things that could increase the chance of an insufficient cervix. So cervical trauma is one of them. And so, for example, if somebody had a surgical procedure following an abnormal PAP, sometimes that could impact the cervix. Like say if there is a colposcopy, like a biopsy of like on the actual cervix, that could impact it. Other surgical procedures like a DNC used for abortion, or if a woman, needs to clear the pregnancy for any reason, a DNC could lead to cervical insufficiency. It's certainly not like a reason to not get a DNC if you need one, but it does slightly increase the risk of an insufficient cervix. Okay, and then congenital conditions. So uterine abnormalities and genetic disorders that impact this like fibrous type of protein that makes up the collagen. This could cause an incompetent cervix. And then exposure to something called DES. This is a synthetic form of estrogen, and it's something that has been linked to cervical insufficiency. And then something else is if you've had an insufficient cervix in a past pregnancy, that means you have a higher risk of having it in later pregnancies. While you can't really prevent an incompetent cervix, there are things that the doctor can do to try to like minimize the softening and the opening. So they can give you medication. They might just do a lot of ultrasounds to just like monitor what's happening with the cervix. And there's also something called cervical curettage. And what this is essentially like suturing up the cervix, like sewing it shut, and then around the woman's for the baby's due date, or when the care provider feels like it's time, they just remove the sutures so she can have the baby. So that is, you know, a common, I don't want to say cure, but a common option, especially when the cervical insufficiency is more extreme and the OB is, or the midwife, they're really concerned that it could lead to pregnancy loss or premature birth. So they can do cervical curettage, which is again, sewing up the cervix until it's time for the baby to come out. And then of course, if you are experiencing this, you want to make sure that you're really staying healthy, you're seeing your care provider regularly so they can monitor the situation, you're eating a really healthy diet. You especially want to focus on folic acid, calcium, iron, getting in all those essential nutrients. Prenatal vitamin is obviously a great way to do that. You want to make sure it has at least 600 micrograms of folic acid. And then you want to gain a healthy amount of weight. So you don't want to be underweight, but you don't want to also gain a lot of weight. So there's like a lot of pressure on your body. A lot of care providers recommend gaining about 25 to 35 pounds, but this also just kind of varies based on the woman. And so it's important to discuss it with your care provider and figure out a plan for your unique needs. If you have any questions about this, anything else about pregnancy, childbirth, early motherhood, let me know in the comments below.